Thanks for the terrific introduction, Andrew. I'm so thrilled to present today, and I'm glad to hear that you guys were excited about the development of our Epic dashboard at UCSF as we were. So hopefully I could get others excited about our work too. Just a huge thanks to CARRA for supporting our Center of Excellence that started in mid-2022. I wanted to just briefly overview our COE and then jump into showing you guys our dashboard and things. But I just wanted to highlight the name of our COE called I Jump Up, and then our registry of biorepository called JUMP. And I want to really especially highlight Jessica Neely, who partners with me in this effort for our COE at UCSF that takes place at two sites, one in the San Francisco office and one in the Oakland office, alternating every other month, once a month. And just briefly, just related to the pillars of care of our COE and really broad strokes, and really I just want to highlight some of the awesome members of our team going from right to left. I just want to highlight our research coordinators that partner with me and Jessica Neely closely, Zilan and Bethany. We couldn't do any of our translational research or registry research without them. And then just jumping over just to clinical care, during our COE, we partner with our dermatologists that have expertise and interest in inflammatory skin diseases, Kelly Cordero, Anna Mather, and R.C. Ahmed at the Oakland and the San Francisco offices. So they really help with some of the really challenging cases of skin disease. And then another major player of our COE is our physical therapist who works with us at the San Francisco office and does especially the complex assessments, the CMAS, 6-minute walk test, and also gives recommendations to our patients. And then just another huge shout out to our social workers that work with us, Jenna, Marielle, and Carolyn, but a special shout out to LaCandia Sellers, who has joined our team this past year as our JDM liaison, who leads our patient advisory council with patients and parents, and then is working on developing more in-depth education and coping supports for our patients and families. But the reason why we're here today is not all of my awesome team members, but our idea of awesome clinical care requiring the pillar of standardized assessments. And we really think standardized assessments are really important for following patients through time. And that's why we thought an important part of building our COE was the development of this dashboard. So why a dashboard for JDM? And any of us who have a child with JDM or have cared for a child with JDM know that there are so many moving parts to assessing kids with JDM. There's their lab tests, there's the medications they're on, there's their skin disease, there's their muscle disease, there's damage related to their body related to longstanding disease at times. So putting all those parts together is really needed to make informed treatment plans for both the clinicians and the parents. So I really thought a dashboard would be important to pull together information in a centralized way. When we see patients, I think we have notes scattered here and there. And a lot of times, we know our patients so well, so we think we remember what they look like last time, and it's hard to look at 100 notes back, but centralized information would be great for a dashboard. We thought a dashboard where all the information would be in one place, but customized for JDM, because there are special assessments in JDM that's not done for other conditions like JIA, would be super important. Also, processing information visually we thought would be awesome, because like looking at just numbers alone or different pages, it's hard to synthesize all that information. So we could have data-driven decision-making with visual representation, and then also be able to communicate with other clinicians and our patients and families so that we can align our goals with patients and families. So yeah, so that's why we built the JDM dashboard, and we've worked with some of our programmers at UCSF to do this. I think we're going to jump into that now, and then I've just made snippets from some of my epic screenshots to show you guys what we've done. I know other sites have done other things related to collecting patient information also, and I know there's a lot of exciting work going on in different places, but we're really proud of the work that we've done. So here is a snapshot. I hope, I'm actually not sure. I think most sites use Epic, but I think probably 90% or so of sites use Epic, and UCSF uses Epic, and I know other sites who hadn't used Epic in the past are transitioning to Epic too. But in Epic, we built this tab called JDM Tools here. Okay. And this is a specialty navigator. And within the specialty navigator, if you click on that, you get to this section that looks, it's actually bigger than this, but it's hard to show on one page, but it shows a specific smart forms within the specialty navigator, which collects smart data elements. So that's a lot of information, but I think we wanted to make it practical to use, easy to repeat, and so forth. So I'm going to just walk through some of that. You see on the right over here, we have some measures that can be tracked over time. I should also mention that we incorporated some patient-reported outcomes, including the PHQ-9, and then there's some promise measures here as well. But let's just jump in and see what you guys think. So it's just starting with strength assessments. Sorry. So there's these tabs related to strength measures. So if you click on one of those tabs, you'll get here to this section. And we standardly collect the MMT8 in all of our patients. All patients in our COE basically get a CMAS score, but we've also pulled out other specific components of the CMAS score that we think are really important related to strength assessment and stamina and so forth. But this looks like a lot of information and hard to fill out, and I know it looks kind of overwhelming. So we try to make it as easy to use as possible. So this awesome tab that says set all strength assessments to 10, I think, you know, hopefully when most of our patients are doing well, most of the strength assessments are 10, so we could just modify just a couple of the elements. So if you click on set all to 10, they'll actually all go to 10. It will auto calculate your MMT8 here. And if you change these values, it will auto calculate to lower values. We could put in CMAS values too. And then specifically, if you weren't able to fill in these items, then you could say why we didn't fill them in, if it's due to age, due to weakness, time constraint, or some other factor. And as I mentioned, we pulled out these specific things related to CMAS on the, especially on the rare events, on the events that full CMAS isn't completed. Also related to some modified strength testing scores that have been developed too, we pulled out the timed assessments from the CMAS score because I think it's a really important measure of stamina too, and those are kind of listed here. So yeah, that kind of shows us different ways that we measure and record strength assessments in our patients. And then the next smart forms, I'm gonna just show you, breeze through our skin assessments. So, skin assessment. So some of the skin assessments that we collect are the CAT scores. And again, this could look like an overwhelming amount of information, but it's actually quite easy to fill out once you get used to filling it out. It's simply the different skin manifestations if you have them or don't have them. And we've made it easy to say no to all of them and just click yes on some of them by having this easy tab saying set all values to no. And it automatically calculates the CAT score for you. If you change some of them to yes, it automatically recalculates the CAT score to show more disease activity there. And then there's something called the CDASI, which is another skin assessment score that needs an academic license for use. But we've incorporated that into our dashboard as well. And anyway, we like using the CDASI, and I've gotten used to using the CDASI here, but I know it's a lot of information. But again, we've made it easy to use with different tabs that can set all to 0, so you can make adjustments in the single areas that might have skin disease activity or damage. And yeah, so you could see here, if I click set all to 0, they'll all go to 0, and it'll collect, tabulate the total activity and total damage scores to 0 as well. But if you have different disease activity or damage, it will also calculate these scores for you for easy tracking. Okay. Oops, that's there. Sorry, going the wrong direction. And the other things, some of the slides got out of order, sorry, are visual analog scale scores that also collect disease activity scores in more straightforward ways. And we like to use these as a gestalt of disease activity at our site. People do collect these for research purposes, including in the CARRA registry too. But we think that muscle disease activity, joint disease activity, skin disease activity is all important to collect in this mode as well. So we've incorporated this into our dashboard. So again, it's easy to fill out. We could set all scores to 0, and that's pretty straightforward. But we could also not to change them to other values. So if we change them to other values, for example, if we change skeletal disease to 0.5, it will ask you the specific questions related to skeletal disease, why we think that is an active measure at the time, and so forth. And we also collect damage measures too. And again, the vast majority of our patients have no damage, but of course we do have patients with damage, and it's important to collect that information over time. So the damage score can also be tabulated easily with the box blue to set all scores to 0. But if there is a disease damage too, again, it can collect information in more detail related to damage, and then also calculate an MDI score automatically. Oops, sorry, wrong way. Okay. And then the other cool thing, so that's a lot of information to collect, right? And not everyone might not collect all that information, but we tend to collect all that information for our COE patients because we think it's important for lots of different reasons. So the graphical kind of visual representation of the disease activity we think is helpful. And you could see them kind of listed here, like MMT8, arm lift, leg lift. We added some other things like squat, CMAS score, some global scores, some damage scores, skin activity scores, etc. So I just want to show you kind of what that might look like through time. So through time, we might see that at the beginning of diagnosis, this pink line indicates the manual muscle testing. So it might be lower in the beginning, and hopefully with treatment, it improves. And you can see that through time. You could see that timed assessments improve through time, the CMAS improves through time. You can imagine if patients are having flares, you could see changes in these that you might be able to notice sooner before there is a big, more overt flare of disease, especially before muscle enzymes act up and things like that, or before there's limitations of activities of daily living. So we think this trajectory through time is really helpful for the clinician to look at, and for you to look at with your patients to really discuss, what treatment has been doing for your patient. And same thing here, things track through time, visual analog scale, track through time, damage, track through time, and skin activity score to track through time. Okay. If you look further below from that same page on the specialty navigator, you'll have medications. So you'll be able to track over time what medications patients were taking at different times when you assess these different measures of disease activity. So we're hoping that these two pieces of information in combination will be helpful for informed treatment plans instead of doing the look back or trying to dig in your mind what the patient was doing 6 months ago or a year ago. We're hoping that this dashboard will bring all that information together for the clinician and the patient together. And then I think for those of you who have EPIC, there is good lab trending that you can look at through time related to muscle enzymes and so forth. And this is a nice representation of that here too, where patient might have had some improvement in fluctuations in muscle enzymes through time. Okay. And then we've also put PROs on our dashboard too, including the PHQ-9 that can be filled out, the PHQ-9 that can be filled out with the patient, or the patient could fill it out on their own on my chart. And I think you guys are familiar with the PHQ-9, and I think folks are going to discuss it in more detail later on. But we also have other questionnaires that are collected here, including some of the key promise measures that we like to look at in our JDM patients. So this is a lot of information, I know, but in addition to having it here to share with your patients, we could pull it into our notes, because that's a big deal, like how to get this information into our notes and get compensated for all the work that's being done in the assessments as well. So we made an easy way to incorporate this into our notes in a simple dot phrase called JDM All Scores. It pulls in the things that we thought were pertinent to include in our notes here. So here's an example of what it would look like there. Yeah, that's a lot of information I'm running through. But next steps we're thinking of locally are to iterate and improve locally. We've been using it in our COE at every COE and filling in all this information and starting to share it with our patients. And we're going to work on getting additional patient and parent input about the setup of the dashboard and how we might be able to modify it and improve it for being able to understand it and things like that, and other things that patients or families might want to include, and also getting additional clinician input from other clinicians who are using it in our practice. Future directions definitely are how we can share this more broadly. So in speaking with our EPIC programmers, just going down to the third bullet, we can work on sharing these build extracts that have been built at UCSF and give instructions to other sites. And that's definitely a possibility. That would require a little bit more work on our programmers' part here, and then time spent with our programmers to talk to programmers at other sites. But that is definitely a possibility. Another possibility I've discussed with our EPIC programmers is bullet 1, where it is possible that we can make our smart data elements available more widely in EPIC. With some modifications, we can pose it to EPIC if they could release it as an EPIC released shared data element, which I'm told by my EPIC programmers wouldn't be extra cost to other EPIC sites. And a third option we can consider related to more broad use of the dashboard is whether or not these can be incorporated by the EPIC leads to incorporate into the EPIC Foundation itself. And I have a message out to Alicia Taxter, who works with CARRA and works with EPIC pretty intimately, who's part of some of the people who work on EPIC and at the EPIC Rheumatology core too, and they are really in the early stages of building a JDM kind of EPIC Foundation. So those are some options I think are exciting to be able to share this work with other sites and improve care for our patients with JDM too. So I think that's my last slide, and I see some chats that I haven't been reading through, but I'm happy for any other questions or comments, and really thank you for your attention, and thanks for all your questions.
Yeah, Susan, if you can see the chats, if you just want to read them, read the question out and then answer it rather than me read them out, that probably might be the best strategy.
So I think so Kathy asked, is this tool available to anyone with EPIC? So I think those bullet points I pointed to. So I think the EPIC build, having it incorporated into the EPIC Foundation is probably years out. And I think that probably specific to JDM, that's probably years out. So I think really our better bets are the second two bullets. If we could build smart data elements that Epic would agree to make available to all Epic sites, or if I could share what I've built with other sites and share the build extracts with other sites that they can incorporate into their Epic workflows locally. So I think that was that question. And then Dr. Ryder asked the possibility of using a visual analog scale instead of the 0.5 scale. So that's a great question. Thank you. We try to, fortunately or unfortunately, to align with the CARRA and the way data is collected there, we did match the way those data points are collected, like 1 or 0.12 or 0.51, that mirrored what CARRA is capturing too. So I hope that answers your question, Dr. Ryder. I don't know if there's a follow-up to that you could think about. And then Suzanne asked the question, does it go into the clinical summary for patients and families? So we can share that with patients at the visit. We could definitely, Epic is a strange beast, I have to say. It seems like easy in my mind to be able to program something for it to go into like an after visit summary or something like that. But it turns out that Epic doesn't work quite like that. So one workaround definitely is that we could screenshot it and email it to patients or my chart it to patients or print it out for patients at each visit, but it doesn't go as part of a separate summary for patients as part of the after visit summary. But it's something we definitely work on trying to review with patients at their visits or at the end of their visits or at interval visits. But that's a great question, Suzanne, and something I really asked for too, but my Epic programmers told me that's just not the way those specialty navigators function and work. And I think that's true for the specialty navigator that's been built for arthritis too. And then Joanne asked a question, just commented, I think, that she's excited about the dashboard. Thank you. Yeah, and then yes, definitely. And it definitely is a huge help to our research coordinators because it makes it much easier for them to fill out more complete information related to our care registry visits as well. So yes, so it's double dipping, and I like double dipping and getting bang for the buck where we can use work we do for one thing to help lots of other things. And I think that's what we're doing with our dashboard here too. Thanks, Joanne. And okay, yeah, so it is possible for multiple people to enter data into, so Jessica asked about multiple providers inputting data. So that is a possibility, but right now we haven't asked our dermatologists to do that yet. I don't know if you guys know how busy dermatologists are, and they're usually only allowed like super short periods of time with patients. So we haven't subjected them to doing that for us yet, but they definitely help us to assess scoring for some things we might have questions about. And physical therapy has been working with us to help input some of those values as well. Is this, and then Jessica also asked, is this used on non-JAM clinic days by Peds Room? So it is available to all of my Peds Room colleagues to use. And I wanna or have to do more formal training on a broader basis for all the members too, but anyone can use it on my team right now. But I have to say that I think even for JM folks who take care of patients, I don't know, it seemed like a lot, right? It seemed like a lot whatever I went through. So I think without knowing or getting used to it, it feels really overwhelming. But I think you will know if you talk to me or Jessica Neely that we're pretty accustomed to this dashboard and really enjoy using it and don't find it too cumbersome, and that it's great to follow patients through time and incorporate into our notes too. And then I don't know, Nadina asked about sharing with centers outside of the US. Is Epic used outside of the US too? I actually don't know that answer. And I could find out, and if Epic is used outside the US, if it is shared, then it's shared broadly, or if there's US specific Epic shared data elements, or if it is like international. I could try to find out about that from Alicia, who I have a meeting with. Okay, and then I think Leslie answered the question, but has a different name. But then I don't know if they incorporate all the same stuff though, Leslie. I don't know if you know that. And okay, and then Ingrid had a answer that also says yes, that it is used internationally. So I know Canada, yes, Canada uses Epic as well. And okay, yeah, lots of comments that it is shared, but not maybe as broadly as we'd like. But I think there's lots of exciting possibilities related to the dashboard we've created for our site for sure, and hoping to be able to share it more broadly in the future. And I actually, there definitely is effort associated with kind of the bullets that I shared related to trying to make the smart data elements available on Epic more broadly. But I guess I would have to know or find out from colleagues how much interest there is in all that to make it worth the time and effort. And I'm hopeful that folks are interested, but it would be great to get feedback from folks that is the case. And I would like to think about moving forward on making it more available more broadly. Thanks. I think those are all the questions I hit on.
I think you may have missed out one from Carve on
okay, sorry.
The build cost, both hours and time, if you've got any sort of feel for that.
Yeah. I'll have to look back on how much we've been billed so far. The estimate that we had, because they did have to spend a lot of time because it was kind of from scratch and like an idea and kind of from scratch that they helped build this for us at UCSF. But I think it may have been about 11K, 11K or so with from start to where we are right now. If it came to adding it to other sites using the smart data elements that we've built here, then the coding is all done. So hopefully that cost will go down tremendously for your local sites, if you could use the programming that's already been done here. I would expect the cost to be much, much, much less than the number I just estimated from my recollection. Thanks, Kaveh, for that question.
Thank you, Susan. I'm so glad to see that it stimulated as many questions from your colleagues as it did within the foundation. So obviously, if anybody has an interest, reach out to Susan directly. As a foundation, we'd obviously love to know how many people take this on board, and if there's anything the foundation can do to help facilitate this, please reach out to me as well, and we're happy to help wherever we can. Yeah, we think it's amazing, and congratulations, Susan. This is a monumental effort and a fantastic tool, so well done to you and your team.
Oh, thanks so much, Andrew. And if we could, if folks in the Clinical Care Network and the COE network of CureJam were interested, and there was enough interest from folks and maybe even support from CureJam to help launch it at different sites, that would be a great future endeavor that I would be excited to be part of. But thank you so much for letting me take the time to present this, and I look forward to all the subsequent talks, and feel free to reach out to me with any questions or input about all this. Thank you, guys.